Hello, this is Dr. Gay from First Look MRI, and this is a 45-year-old gentleman who injured his knee playing soccer a couple weeks ago, had knee pain, and went to the hospital. They did some x-rays, and they said they looked normal, and he was sent home, and still experienced pain, difficulty walking, and decided to just come on his own and get an MRI scan. So he came into the First Look and got this MRI, and it shows the femur looking great. So he has a nice normal femur. Tibia down here looks normal. So you can see why the x-rays look so nice. Just no arthritis, no marrow edema. This is his medial knee joint. That little black wedge is the medial meniscus. It looks pristine, wedged in here between the femur and tibia. Lateral meniscus looks great as well. So no abnormalities there. This is a fat suppressed view. We see a little bit of fluid over here on the outside, but otherwise looks pretty good. Just a little bit of fluid. This is kneecap up here on this view. Now we're going to look from the side, the profile view, and in the profile view we see that he has a problem. So on this view we see the femur coming down, we see the tibia, we see his anterior cruciate ligament looking normal, his posterior cruciate ligament looking normal, so that looks good, but the kneecap looks funny. So the kneecap is here, the patella, and it's too high. And this is the quadriceps tendon, all the thigh muscles attached to this, and it comes down here to the top of the kneecap. So it looks a little thicker than usual, and then the kneecap again is higher than usual. This is the epicenter of the kneecap, and usually the epicenter is more down about here or so. So really high riding patella, and that's because his patellar tendon is ruptured. So the patellar tendon goes right from here down to here, and the quadriceps pulls the kneecap up, and the patellar tendon pulls it down to the tibial tubercle here. But he's got a complete tear, and there's fluid from the front of the knee going into where we should see the patellar tendon. So ruptured patellar tendon with high riding kneecap, and again on the x-rays everything looked normal, so that's why he was sent home. But this is something that's obviously they're going to have surgery, and the sooner the better, because if you don't have surgery pretty soon the muscles will start to atrophy and contract, and the kneecap will be pulled upwards. And it can be hard to pull the kneecap back down when the muscles shrink and contract. And so hopefully he'll get in there sooner than later and to get this thing repaired. But a case of a normal x-ray, patient being sent home, and came out on his own to find out he's got a ruptured patellar tendon.